Assalamu alaikum. Today our topic is rheumatic fever. So rheumatic fever, we know that it is a post-streptococcal infection and which causes a fever and which causes a rheumatic heart disease. This is the overview. So basically, when a person is infected with some streptococcal infections after the treatment or after infection, patient will be okay. But after a few days, there's some immune reaction occur in our body which causes production of antibodies against our own antigens. So problem is that the infection for the streptococcal infection initiate immune response which make antibodies and which mismatch with our own antigens, and so our immune system make antibodies against on our own tissues. So this mismatched reaction or autoimmune disorder reaction which causes damage to our own body organs, so which causes rheumatic fever. And further most complication occur on the heart, which is rheumatic heart disease. So rheumatic heart disease we will discuss detail in cardiac pathology, rheumatic heart disease, in which we will discuss each part in detail, like rheumatic pericarditis, rheumatic myocarditis, and rheumatic endocarditis. But now we will just discuss general about the rheumatic fever, how this will happen. So first, when person infected with some sore throat in pharynx infection start, this then microorganism which causes this is streptococcal beta hemolysis Lancefield group A, which have rheumatogenic strains. When infection start, immune system when infection start, immune system attacks this bacteria and they destroy it. After it, this form antibodies against it. No bacteria and proteins are almost similar to our own body tissue proteins, so immune system mistakenly make antibodies against own tissues, which cause damage to own body tissues like heart, synovial membrane of the joint, CNS, and skin, etc. This will be multisystemic non-spreading inflammation because no pus formation. This is acute severe inflammation. So lot of pyogenes, cytokines cause fever and also cause rheumatic fever. Next it develops 2 to 4 weeks after pharyngitis, like streptococcal infection infect our pharynx and cause inflammation of pharynx, which is called pharyngitis. So after patient treatment of pharyngitis, after few weeks it will develop rheumatic fever. Maybe it will take times, but after few weeks our immune system make antibodies against our own body antigens because the antigen of the microbes is similar to our own body antigens. So antibody will be for microbes, but it mistakenly attacks our own body tissues. It develops 2 to 4 weeks after pharyngitis. Only 2 to 3% of population infected with this rheumatic fever when pharyngitis occur. 98% population produce immune response which react only bacteria. Bacteria do not find in affected organs. So antibody is basically for the bacteria, but it sometimes mistakenly match with our own antigen, so it will attack our own body tissues. Bacteria do not find in affected organs. CNS. 1 minute, I will enlarge it. So CNS immune system attack basal ganglion, led to the which have neuronal circuits and load of motor programs. If inflamed, the information going inappropriate, patients start moving limbs purposeless, which is called chorea. So basically, our immune system, a CNS system, which have some motor program like basal ganglion, if this will be affected, then all the motor program will be disturbed. So patients start purposeless movement like chorea. Chorea is when patients start purposeless movement without any purpose, randomly moving their limbs. So this is called chorea, which is very diagnostic feature of the rheumatic fever. So chorea of two types: involuntary purposeless movement, rheumatic chorea or Sydenham chorea, and the other is distinct vitus down chorea. This occur mostly in women. Once once immune process damage central nervous system, any detached central nervous system will recover. So after rheumatic fever will end, our immune system our body will be recovered from this damage. Second affected organ is affected part is joints. So first we will discuss about the what is disease of the joint. First there is arthritis. Arthritis is inflammation. If inflammation and pain, tender, swollen, and swollen joints. If these are the symptoms present in the joint, then this is arthritis due to immune system. What is arthralgia? Just pain to joints major sign to diagnostic rheumatic fever. This is the major sign to diagnostic fever while there is a pain in the joints. Other is polyarthritis, multiple joint inflammation is polyarthritis, migratory polyarthritis, inflammatory pattern changes with time. For example, sometime in the morning have pain in the joint, sometime after exercise he has pain in the joint. So this is the migratory polyarthritis. So these are the basic some terminology difference between the disease of the joints. This disease peak at 5 to 15 years, so mostly children are affected. To child, if pain is severe and we give high dose of aspirin, symptom of joints inflammation disappeared quickly. But until migratory nature of the arthritis not cleared, because if patient is rheumatic fever, so he should take prophylactic antibodies up to 20 antibiotics up to 25 years age, so streptococcal cannot attack again. So basically the child which is affected with rheumatic fever, we should he can also again affected with rheumatic fever if the again this streptococcal in organism will attack on the joints, or for example attack on the child. So we must give these anaphylactic antibodies antibiotics to the child for up to 25 years, so there will be no rheumatic fever until this. If you do not diagnose rheumatic fever, child will develop rheumatic fever multiple times, and after few years he will develop valvular heart disease. So diagnosis must be on time to treat this disease. If it will be prolonged, then it causes some serious heart complications. Valvulitis is the most common cause of this rheumatic fever in chronic rheumatic fevers, which causes multiple damage to the heart, like congestive heart failure. Most commonly is mitral valve, and which is causing mitral regurgitation. And if this rheumatic disease or the antibodies attack on the myocarditis, which causes dilating of the left ventricle, and later on there is congestive heart failure, and may patient die from this congestive heart failure because heart will fail. Next is if you do diagnose and valvular heart disease, pain is severe but not long-term complications. But when fever is over, joint will be normal. So CNS will also be normal after the rheumatic fever, and the joints will also be normal. So second is the skin. In skin, it will produce lesions, small macules which rapidly grows and become crescent like moon shape, like needles. First inflamed red, then center area healed, then margin will be inflated. This type of inflammation is erythema, red margination. So in this inflammation, first inflamed red, then center area healed with margin, and will inflame. This type of inflammation is erythema margination, which is clinical diagnostic feature of rheumatic fever. Erythema red shape with margination in the center with crescent shape. These are the diagnostic features of the lesion on the skin to recognize rheumatic fever. Usually painless, more common skin in center part of the body, no long-term complications. So every complication from the rheumatic fever is not long-term. It will be recovered after the treatment is done. So subcutaneous tissue, fat or fascia attached and formation of subcutaneous nodules. It is only 1 to 2 centimeter formed with extensive surfaces under limbs, non-tender, attached to synovial joints of the tender or bursa. Next is the most common complication is the heart, in chronic heart rheumatic fever especially. So in heart it causes three: rheumatic carditis, rheumatic endocarditis, and rheumatic pericarditis. Myocarditis involved in the mostly the myocardium. So this is the aorta, left ventricle, atrium, left atrium, and this is endocardium inside layer. In the middle there is the myocardium, and outside there is the epicardium and the pericardium. Pericardium is the outermost layer, and outside the epicardium there is a pericardium. So in rheumatic patient, 2 or 3 features are present. In rheumatic fever, 2 or 3. For example, in rheumatic fever, if the patient is rheumatic fever and you have to diagnose there is a rheumatic heart disease or not, so there must be endocarditis with myocarditis or endocarditis with pericarditis. Or almost from 3, only at least 2 features will be present in the rheumatic heart disease patient. So the next is rheumatic pericarditis. First, rheumatic pericarditis. Immune system attack pericarditis. Endothelial cells shrinks and layer enter endothelial gaps. Immune system attack pericarditis. Endothelial cell shrinks and layer enter endothelial gaps. Leakage Leakage of very leakage of large protein molecules, fibrinogen, and it convert into fibrin strands and start accumulate pericardium, which called fibrinous pericarditis. Feature of immune mediated pericarditis or bread and butter carditis, while its layer separate pericardial layer and deposit insides. So this is rheumatic pericarditis, in which when there is immune-mediated reactions, so increase the endothelial gaps and causes the migration of more fibrinogen from the blood into the this pericardium, and it will convert into the fibrin. So fibrin strands will unite together and form a fibrous pericarditis. This will produce pericardial chest pain. It is central pain in chest. It is sharp, well localized, relieved on leaning forward. I will discuss detail in pericarditis about all the acute pericarditis, endocarditis, and all the information about the pericarditis in the cardiac pathology playlist. So you can check out this. It is central pain in chest. It is sharp, well localized, relieved on leaning forward. For the patient is leaning forward or chest increase down his chest into the forward, it will be decrease in pain. Ischemic heartbeat dull and diffuse. Ischemic heartbeat cannot decrease on leaning forward. So this is only pericarditis pain which will be relief on the leaning forward, but no long-term complication. So there is also no long-term complication. Myocarditis. Rheumatic myocarditis, we found as shock bodies sorry, present around perivascular tissues. There are inflammatory lesions on which are immune mediated granuloma present in all three, but classically develop in rheumatic myocarditis. Myocarditis develop during the acute rheumatic fever. It is most dangerous phase because it is become loosey and flabby and contract very poor, led to the congestive cardiac failure. So same thing. It led to ventricular failure on cardiac feature or cardiac feature. Sometimes that causes death. Cardiac failure that causes sometimes death. Death is rheumatic myocarditis. So basically, I will explain this. What is the shock bodies? Shock bodies is a rheumatic lesions occur in the myocardium, which is due to the basically when the antibodies attack on our myocardium, it will damage to collagen fibers. Collagen fiber will damage and break it down into pieces. There are a lot of cells come like neutrophil, eosinophils, macrophages, and B cell which make antibodies. So these all cell make damage to the collagen and their small pieces and their formation of the lesions and inflammation. This lesion formation area is which include collagen fibers, fibrin, or other cells called shock bodies. This multiple shock bodies found in the myocarditis and which causes damage to inflammation of the myocarditis. Due to breakdown of the collagen, there will be decreased elasticity of the myocarditis when there is myocardium. So when there is decreased elasticity of myocardium, it cannot be contract properly. So when it will not contract properly, it will become flabby or loose. So with loose contraction, the annulus fiber of the ring will also lose. So first it will do with the loose muscle, it cannot contract well, cannot pull the blood into the aorta properly, and with the loose tissues, it cannot hold the mitral valve properly. So it will also occur mitral regurgitation. Blood move back from the ventricle into the left ventricle to left atrium. So will cause the dilating of the left ventricle. When there is a dilating, more and more blood start accumulating in the left ventricles, and later on we develop congestive heart failure. Heart cannot pull blood into the aorta. So this is very dangerous. This will cause even death of the patient if this will be a chronic. Rheumatic endocarditis, in which rheumatic endocarditis mostly valves affected with the mitral valve is most common, then aortic, and then right side valves like tricuspid valve, and there's the pulmonary valve. So most common valve is mitral valve. Valves affected valvulitis, valves will be inflamed. This will cause endothelium erosions and platelet will stick and fibrin deposit and form aggregation. This is called vegetative formed in the surface of the valves. This is something blood. This is called vegetation form. Vegetation are the lesions of the in the endocardium. Same with the shock bodies, but in the endocardium we call them the vegetations, lesions, small lesions. In the myocarditis there is a small cell accumulation. We call them shock bodies. So they do not have any microbes. So sterile vegetation, while without any bacteria. Chronic rheumatic fever. It is chronic rheumatic disease complication. So endocarditis is chronic rheumatic disease complication when again and again rheumatic fever, then calcification of valves occur, At the age 17 to 18, child develops fever. Child develops severe valve lesions, repeated attack or rheumatic fevers. So at the age of 17 to 18, patient will develop severe valves damage, and it is very dangerous because next the condition is will be congestive heart failure. So patient should be treated with this rheumatic heart fever. If the patient cannot treat it, then the rheumatic fever attack again and again, which causes chronic rheumatic fever and damage to the heart muscles. So will lead to congestive heart failure. So this is the topic today. It is small brief introduction about the rheumatic fever, what is rheumatic fever and what are the complications. We will discuss most common complication in this. There is a heart pathology, heart complication. So in cardiac pathology, we will discuss about detail about the rheumatic heart diseases, in which we'll discuss again endocarditis, pericarditis and myocarditis detail. Short body obviously we will discuss in detail in the rheumatic heart disease in cardiac pathology playlist.